When every second counts, nothing should stand in the way of saving lives. The highly trained teams of healthcare professionals who work here can perform miracles, but they need both the tools and the reliable communication systems that make those miracles possible. Life hangs in the balance on a daily basis here in the operating rooms. But finding ways to balance the budgets of these complex facilities is critical so that the hospital's economic resources can be maximized for patient care and minimized for support systems. The University Health Network's enterprise communication strategy provides a wireless communication solution that is a vital part of both the operating rooms and patient services here at Toronto General Hospital.
There can be up to 19 rooms running during the daytime, and then you have to be ready for emergencies that can come from anywhere in the hospital.
Operating room time is the most expensive real estate in any hospital, and with the waiting list growing for all patients, it was our duty to patients to ensure that we maximized our utilization and maintained the best flexibility possible.
Part of the initial assessment in Betty Watt's team was to figure out what it was costing them per minute not to have that room utilized. And it was about $128 per minute. Furthermore, if you look at the average pager response, probably 3 to 5 minutes. And if you do the math there, it adds up very quickly.
Our patients are very ill. We are the biggest and most complex operating room in the country. Our patients are unstable, and we need instant help when we need it. So for the communication system, we had to have something that was nurse-friendly, that was user-friendly, that was great for patients. And the future of surgery is very unpredictable. Nobody's sure what the future holds for us. So we wanted to be very flexible.
We had to build an infrastructure for the phones and the computers, etc., to communicate. And in this floor and all the other floors on this building, it's a wireless infrastructure. So we're using SpectraLink phones that work really well with our phone system. In addition to phones, we've got computers out there through an application that anytime there's a request for a particular service, that message is quickly sent to whoever's appropriate.
Regardless of the technical complexity of any solution, the greatest challenge is to make all of its functions simple, easily accessible, and intuitive for the users.
We've designed the system to be as simple to use as possible. Nurses don't have a lot of time to learn to use new technology. So like a wired telephone, a wireless telephone needs to be very simple to use. Integration with text messaging systems is important because not always do you have the opportunity for someone to actually make a telephone call. And being integrated with those types of systems means that the wireless telephones can provide not only just voice communication but also text messaging that can provide people with the right information that they need at their fingertips, and then they have a telephone they can go and make the appropriate call or go to the appropriate department in order to deal with whatever situation that comes up.
The techie people know the technology. We, the end user, know the needs. And I think it was the marriage between the end user and the technology people that has given us the perfect product.
In the OR area, seconds often make the difference between life and death.
I'll tell you what I tell everybody when they come through their tour. What I like the best of the system, and it happens every other day at least, the button on the wall is pressed. I get a phone call, and in 10 seconds you have 8 people, and we all go and we aid and we know what to do right away in the case, and we can help.
Because of the time-saving component with the communication system, we've been able to actually save lives.
The solution allows them to work seamlessly without having to slow down and think about what they have to do to call for assistance.
But even just in terms of managing the efficiency of the operating room, they're much more efficient when they can communicate better about changing over rooms, about making sure the room is stocked for the right type of procedure as it comes in there. And in some cases, they've actually proven that they can do more procedures within the same period of time, which actually provides a positive return on investment for a wireless telephone system.
I can't imagine not having it anymore.
We as a group of people are always fatigued because we work long hours and there's a lot of demands on us.
Integrating with the nurse call system makes the nurses much more responsive to the patient's needs. So the patient can press the nurse call button, the message goes out to the appropriate nurse's wireless telephone, and that nurse can respond back either by pressing a button or even by setting up a voice call back to the patient, so they can be much more responsive and not have to be running back and forth to deal with trivial needs and be more focused on the more important things.
Certainly this system allows nurses to save steps because they can talk directly to the patient, and I know that they would feel like they were going back to the dark ages if we had to lose them. The actual noise in the nursing station is much less too, because our receptionist takes all incoming calls at the reception desk and dispatches them onto the small telephones of each individual nurse. So the nursing station itself does not have a lot of ringing telephones. We also ask the receptionist to stop overhead paging for anything. The benefits of a quieter environment are very important for patients, and rest is one of the things that helps promote wellness.
We've done studies that have shown a typical nursing unit can save more than 700 hours of time in terms of the time that's spent for nurses going back and forth to telephones, either to return calls or to receive calls, and also the people that are waiting on hold, which are typically physicians or other departments within the hospital. They save a lot of time as well.
The partnerships that deployed this solution have made a significant life-saving contribution here at Toronto General Hospital.
These relationships are important so that we can provide as much functionality as possible into our handheld devices. The biggest benefits in terms of hard dollar justification have to do with better patient care, better results in terms of getting patients through the system faster because nurses are having more time to spend with the patient, and also just having a more productive workforce. We believe that by improving communication, that it allows a hospital to run much more efficiently, it allows nurses to spend more time with patient care, and overall it improves the outcomes for patients.
It's funny how life is that way. You get along without it for 100 years, and once you have it and are comfortable working with it, you can't live without it. And I would say that's a very true statement. Everyone's comfort level, the care and safety of the patient, the coordination of the cases, the adaptability and flexibility and opportunity for emergencies. It's awesome.